Hi everyone, my name is Rebecca, and the intent of this presentation is to provide a brief description of my capstone project that I completed this fall semester. This project allowed me to complete the requirements for my master's degree in nursing education, as well as provide some additional training support for freshman and senior nursing students. Nurses play a critical role in the management of an infusion device, and infusion pump training takes time and practice for nurses to become proficient to administer intravenous medications. This capstone project sought to provide training to senior nursing students on how to program and load a primed IV set into commonly used infusion pumps. Students were shown how to program and load primary and secondary IVs into an infusion pump, as well as preventing and managing some of the common alarms that often occur during infusion therapy. Multiple intelligence theory developed by Dr. Howard Gardner was the theoretical framework behind this project. Multiple intelligence teaching approaches used for this project consisted of using learning objectives to guide student learning, use of visual aids or interactive media, as well as thought-provoking critical thinking questions and hands-on tactile intelligence, as well as reflection. Using this theory and framework, students were more likely to understand content more deeply and increase their ability to improve critical thinking and problem solving. This theory supports the goal for nursing education by using an alternative pedagogical approach to enhance critical thinking and problem solving skills, which would be essential for professional nursing today. Here are some of the student learning outcomes that were identified for the skills training. Supporting evidence was found in numerous scholarly works which revealed that nurses have a vital role in management of infusion devices. Complications that can occur for patients can be prevented with proper education of this technology. Alarm fatigue, understanding the different alarm types, how to manage the different alarms, and recognizing the importance of safety and programming of the infusion devices are crucial to patient safety. Here are some of the project outcomes I identified and successfully completed for this project as well. So another intention of this project was to see if utilizing PowerPoint presentations or demonstration videos prior to the skills lab would lead to better use of time for students and instructors during the lab. The evaluation questions were posted on Blackboard and they were used to evaluate the students' perception of this. I just used a Likert scale format that was posted on Blackboard after the clinical skills labs were all completed, and over 80 students did respond to the evaluations. So as I mentioned, I used a Likert scale for the evaluation. It just consisted of 6 brief questions to evaluate the lesson and the students' perspectives of the PowerPoint presentation as a resource for the clinical skills practice. And I'll go over those results with you now. So this slide just represents the questions that were asked during the evaluation, and we'll go over the results now. So the most important thing from these questions were that most of the students agreed that the PowerPoint presentations were useful in preparation for the lab. I definitely observed that the students that had prepared ahead of time were able to come into the lab and start practicing right away without much prompting. I was there to assist with questions and assist when needed, but the students that had reviewed the presentations ahead of time did not need a demo from me or an intense coaching for the skill. They were able to just come right in, start with their hands-on skills, and just utilize me for questions and troubleshooting and things like that. So 95% of the students agreed that they would like to see more skills presented as a voiceover PowerPoint presentation. However, 65% of the students said they still preferred an in-class demo rather than reviewing the PowerPoint presentations. I think this really depends on the skills, the type of skills that's being learned. In this case, infusion pump skills I think were pretty easily reviewed over the PowerPoint presentation. Tracheostomy care and cleaning of the inner cannula, that I also did a PowerPoint presentation for them, and I think the feedback was that they really appreciated that to go back to refer to, and that gave them the ability to review that before they went back into the skills lab and review the steps, and I think they really utilized that to their benefit. So these results showed that about 84% of the students agreed that they would refer back to the voiceovers in the future. and then about 67% said that they would apply these skills that they've learned into their clinical practice in the future. Healthcare organizations, patients, and nurses benefit from intravenous and infusion therapy training, as it encompasses the initiative of quality, safety, and improved patient outcomes. Nurses are at the front lines of caregiving, and infusion therapy poses an increased risk to patients. There was a case study where a patient who received a heparin infusion received a fatal dose because the infusion pump had been programmed at 600 milliliters per hour instead of 600 units per hour. As nurse educators, we are responsible to educate student nurses as much as possible prior to getting into this situation. There have been reports of over 250,000 people losing their lives each year to preventable medical errors. Nurses must understand the features and functions of infusion devices as well as be able to identify the importance of preventing and rectifying infusion pump alarms promptly. It is also essential for nurses to realize that regular visual checks of the infusion device, medication, the patient, and the IV site are crucial to patient safety. Integration of intravenous medication administration via an infusion pump is an essential practical skill for nursing students today. Adequate training of using an infusion pump for medication administration is not routinely covered in educational programs today, yet the training is essential to reduce errors, ensure the awareness of safety features associated with the infusion pumps, and to use the programmable infusion pump features to support safe and effective infusion therapy. Kamau and Cummings presented a poster on how not only is it imperative to teach student nurses best practices when it comes to intravenous medication administration, but we all must also promote leadership skills that can support their confidence to speak up against poor practice. The student nurse will encounter experienced nurses that may not be following standard protocols, so it will be crucial for student nurses and newly graduated nurses to feel confident in their intravenous medication administration skills. I want to thank the nursing faculty at Murray College for allowing me to complete my capstone project and completing the requirements in order for me to complete my master's degree in nursing education from Excelsior College. Special thank you to Elizabeth Swartz and Vicki Callahan for helping me through this process and being such wonderful mentors throughout this process as well. I greatly appreciate your support, and I am looking forward to working collaboratively with you guys in the future. Thank you.